COVID-19 has dramatically affected the world and our workplace. As we establish a new normal, healthcare professionals need to be able to provide safe and compassionate care for their returning patients. This video covers strategies for preparing your medical office for operation during the COVID-19 pandemic. First off, let guidelines be your guide. Monitor and follow local, state, and federal regulations. As restrictions relax, remain vigilant. Guidelines may change quickly. Explain to patients and visitors before they arrive that all must wear a mask and keep a supply on hand for those who don't have them. Next up, reopen incrementally. Mark a reopening date on your calendar and start with just a few patients a day, gradually increasing over several weeks. Any employees who don't have to be on site should work from home. Third, know the ABCs of PPE. Identify what personal protective equipment is needed, what you currently have, and what alternatives are available. Order all necessary PPE for delivery before reopening. Number 4, create a COVID policy for patients and staff. Consider these questions. If anyone who has visited the office is diagnosed with COVID, how is staff and office cleaning managed? How long should an employee exposed to a patient with COVID remain out of the office? Which patients can be seen remotely via telemedicine? Can staff exposure to COVID be reduced by having employees work on alternate days or in shifts? Maximize patient safety with number 5, socially distant scheduling. Alter your schedule to reduce patient contact and proximity. Schedule more time between visits to avoid full waiting rooms. Separate waiting areas for sick and well patients, moving sick patients quickly to an exam room. Restrict visitors who are accompanying patients to the necessary for patient needs, scheduling necessary visits such as repair work after hours. Strategy 6. Create safety procedures for practitioners and staff. This written policy should mandate that employees stay home for fever, loss of taste or smell, headache, difficulty breathing, other COVID-type symptoms, or if they've had direct contact with someone who tested positive. Employees should be confidentially screened for fever and symptoms. Maximize distance between employees and use dedicated workstations and patient rooms to minimize the touching of equipment. Establish cleaning protocols for shared spaces. Remember HIPAA. Staff and patients can be told they were in contact with someone who tested positive, but don't identify the person without their authorization. Finally, screen patients ahead of time, triaging them by health status and needs. When patients call for appointments, check overall health and symptoms. Screen for COVID-19 symptoms by phone the day before a visit. When appropriate, schedule a telemedicine appointment, postpone an elective visit, or direct a patient to a COVID-19 testing site. There's a lot to consider here, but by creating policies and preparation ahead of time, you can make your reopening as smooth and safe as possible.